Good morning, everybody. Thanks for joining us today. I am Karen McDaniel, the Director of Compliance here at URL Insurance Group. I know the invitation had listed Christy as the introductory person today, but she unfortunately is not able to make it, so I'm filling in for her. I'm going to be passing over the baton to Tom Kennedy and possibly Mike McCook from Capital Blue Cross. Tom is the manager of the broker field sales, and Mike is the director of sales for Capital. And they're going to be going over the Capital Blue Cross Medicare Advantage plans for 2023. Before I hand over the mic to Tom, if you have any questions during the presentation, to your right-hand side, there is the box where you can see a couple different options. There's a chat, there's a Q&A, there's a poll, and there's handouts. I do not believe we have any polls for this presentation, but what I'm going to ask you to do is if you have any questions, please type them in the Q&A box and not in the chat box. That will help us get through the questions a lot faster. And I don't believe we have any handouts except for just a couple of different URL invitations and different things on our website. So with that, I'm going to hand it over to Tom. And Tom, you can go ahead and start.
Hi, good morning, everybody. Tom Kennedy with Capital Blue Cross. Thanks very much for joining me this morning, and thank you, URL, for hosting this. I'm happy to, as always, if you know me, talk about Capital Blue Cross and our Medicare plans and what we're offering for 2023. The presentation I'm gonna run through this morning is a sort of a modified version of a presentation that we did in the first couple months of the year, touching on the presentation was for new members to Capital Blue Cross, and so I'm hoping that it's going to give you a nice perspective on what offerings and how we present Capital to our new members, your clients, and what they can see in some of the digital experience platforms that we offer. And so you don't need to see my mug here on the screen. So I'm going to turn my camera off so we can focus just on the slides. Happy to at the end of my little talk here, hopefully you have some questions and I can field some questions from you and get you all the information you're looking for. So get started. From the member's perspective, and real high level here, obviously, Capital Blue Cross is all about offering, as much coverage and benefits as possible. It's interesting, this market that we work in is one of the most competitive Medicare Advantage markets in the country, as you well know. And so it forces us carriers to be pretty darn aggressive with our benefits and our premiums and our co-payments. We try to keep the maximum out of pocket as low as possible. Certainly staying away from, if we can help it, the maximum allowed MOOP from CMS. All of our plans include, of course, zero deductibles for medical, zero deductibles for prescriptions, zero copayment on tier ones for our prescriptions, and some of our plans have zero copayment for tier 1 and tier 2. I'm going to talk a little bit more about the Insulin Saver program and Capital's participation in that pilot program offered by CMS and what we're doing for our insulin-dependent diabetics. And then, of course, on all of our plans, we include dental, vision, and hearing. Those are the benefits that obviously your prospects and members and clients are looking for when they're looking at a Medicare Advantage plan. Transportation, I think we do a pretty good job in this market with a transportation benefit. I'm going to talk a little bit about that. That's a benefit that's getting more and more utilization with us from our members, because our transportation benefit, I think, is pretty comprehensive when you compare it to other carriers in the market. And then our over-the-counter allowance for drugs and supplies, and how we approach that I think is a little unique compared to some of the other competition in the area. And then, of course, the virtual care visits been pretty popular the last 3 years with the lockdown and COVID. But the platform that we offer for virtual care, I'll talk about. We also like to be as proactive as possible and encourage our members and supply them with tools to be as healthy as possible, and utilize as many of these benefits to stay healthy and be proactive about their health. So things like a zero copayment for an annual routine physical exam, which is in addition to, of course, the Medicare wellness exam that's covered by Medicare. And then zero copayment for, of course, all the Medicare covered preventive services, cancer screenings and things like that, mammograms, prostate exams. Silver Sneakers is included on all of our plans, as well as health education sessions with a certified coach. We have a team of certified coaches. They're tied to our retail team, but members can call and just get a no-cost health education session with a certified coach. And then, of course, super proud of our benefits and support for the 30% of the senior population that is diabetic. And so we have no-cost diabetes prevention, management, and reversal programs I'll talk about here in a couple minutes, as well as zero copayment for self-monitoring and diabetic supplies using our preferred manufacturer, LifeScan. Before I jump into some of that, I always like to make the point when I'm talking to, especially our producer partners out in the market, not only obviously talking to those of you that are already appointed with Capital Blue Cross and are selling our products, but those of you maybe that are considering adding Capital Blue Cross to your portfolio of plans that you present to your members. I think the unique thing about Capital Blue Cross, one of the reasons I joined the organization a number of years ago, is we're the small blue, right? We're a small regional Medicare Advantage plan. We have a footprint of 21 counties in central Pennsylvania and the Lehigh Valley. We've been serving this market for over 80 years. And with that, you get all the benefits of a smaller Medicare Advantage plan, meaning you get the benefits as well as your members get the benefits. Things like member services, which is key, right? We don't outsource our member services. And so when your clients call us, if they have a problem or a hiccup or an issue they need to get addressed, question about benefits or claims, they're calling somebody local right here in central Pennsylvania. We live and work in the same communities as our members. We don't outsource our member services. You're not calling Pittsburgh. You're not calling Connecticut. You're not calling out of the country. When you're talking to our member services, you're talking to somebody local. And so things like that, the benefits, we're never going to outspend in terms of marketing the big national carriers. But what we can do is bring a level of service and support, not only to our members, but to our broker partners that we think is unmatched. So in addition to that, however, because we're a smaller regional blue, a lot of folks, and we get the question a lot, well, can I use my benefits outside of the 21 county service area that is Capital Blue Cross? And the answer is, as long as you enroll in the PPO plans that we offer, of course, because you have the power of blue. And our affiliation with the Blue Cross and Blue Shield Association, the fact that we're a blue, allows access in 48 out of the 50 states. As long as your members are traveling to a state and seeing a doctor that accepts the local Blue Cross and Blue Shield PPO, it's considered an in-network claim, just as though they're going to see the doctor down the street. And that's pretty powerful. Nobody likes surprises, and so we're all about predictable out-of-pocket costs and exposure when they have to use their health insurance or go see a medical professional. But in addition to that, if you happen to go to Wyoming or Alaska, the two states that don't participate currently in the Blue Cross Blue Shield Association PPO Traveler Program, it's considered an out-of-network claim. And as you know, with a PPO, you still have benefits out-of-network. It's just potentially a higher copayment. But what's interesting, when you look closely at our plans, many of the copayments, PCPs and specialist copayments, many of the copayments mirror each other in and out of network. And so to the member, they're not necessarily going to get that surprise or that unpredictable out-of-pocket cost. And so we're obviously very proud of being part of the Blue Cross Blue Shield Association. There's some resources there on your screen for members, or you can look up providers nationwide by going to bcbs.com or calling 800-810-BLUE. And checking providers all over the country. If you have members that are snowbirds or traveling, going to visit kids or grandkids in California, they have those resources available to them to make sure they have access to care wherever they are in the country. So important point. I like to mention that while I'm talking about sort of the why Capital Blue Cross. The digital experience is important to us. 10,000 seniors a day are turning 65 and going on Medicare. And, obviously we're trying to earn the business of as many of them as possible, as are you. This younger Medicare population is a little more tech savvy than some of our older seniors. And so we have a whole sort of platform of digital access to care, starting with our Capital Blue Cross member app, right? In addition to the member app, of course, is creating an account on capbluecross.com. But the app is a great tool because right from your smartphone, you can check claims and balances, find benefits and coverage, even view, share, and request ID cards. You can have a digital version of your ID card right on your member app. Virtual care is another digital tool that has been utilized quite a bit the last few years, but our virtual care app is, of course, zero copayment, doesn't cost the member anything. It's available 24 hours a day, 7 days a week from anywhere in the country. And what's nice about this tool is, especially when you're traveling, you could be out in California and middle of the night get sick and you feel terrible, and you can fire up the virtual care app. Talk to a doctor 24 hours a day, 7 days a week. That doctor can call in a prescription to the local 24-hour pharmacy wherever you are, and you can go out and pick up that prescription, that antibiotic or whatever you need, and get some relief and hopefully a good night's sleep. And so just the flexibility and another tool that's available to our members, we think is a great resource, especially this younger tech-savvy population. There's another screenshot of the virtual care app. You can access the virtual care from more than just your smartphone, any mobile device, laptop, and even if you don't have access to an iPad or an iPhone or a smartphone, you can call the telephone number and speak to a provider 24 hours a day, 7 days a week as well. So great tool and great resource. And then the My Care Finder tool, that's our provider lookup tool that's available online as well as from a mobile device, from online from your computer, from your laptop, as well as a mobile device, where you can search for doctors. You can see real patient ratings and reviews. You can compare costs. And it's a great resource and a great tool. The My Care Finder is available online for our members as well. One other thing I want to mention here also is our Your Rewards program. This is our way of trying to encourage our members, again, to be healthy and be proactive about their health. And so more than a dozen different health and wellness activities can earn you rewards. once they complete one of the rewards that qualifies for a gift card. The gift cards range from $10 to $25, so that you can choose, our members can choose, your clients can choose from retailers including Target, Walmart, CVS, Cracker Barrel, things like that. It's pretty simple to access. This screen is showing just some of the things available, including an annual physical exam, a colonoscopy, and what the reward amount is. And I'm not sure exactly why the annual, or who decided the annual physical exam and the colonoscopy should get the same reward of $25. I'm not sure that makes a whole lot of sense to me, but it's a great benefit, again, to try to encourage members to stay as healthy as possible and proactive about your health. The next thing I want to talk about, again, sort of on the theme of the additional benefits and ancillary items, in addition to our very competitive PPO and HMO plans and low co-payments and low premiums, are some of these value-added benefits and supplemental benefits. And I'm super proud that Capital Blue Cross is an organization that is really committed to and dedicated to helping our diabetic population in Medicare. And we offer 2 diabetes management virtual platforms. These are both online platforms. The first one, Omada Health, is designed for prevention as well as management. Prevention meaning somebody that's pre-diabetic, as well as management and support for those members who have type 1 or type 2 diabetes. The Virta Health program is designed for folks that are currently type 2 diabetic, and it's a diabetes reversal program. It's a physician-led platform, and again, it's a remote medical care focused on sustainable carbohydrate restriction. The idea is to get somebody eating better and managing their type 2 diabetes, with the hope and the goal of getting to the point where they're not dependent on their medication anymore for type 2 diabetes. And so 2 great platforms. We get testimonials and hear from current members every day of their success on both of these platforms. We were at one of our member meetings last month, and a woman had lost 70 pounds. She's on Virta Health. She's type 2 diabetic and lost 70 pounds and is on the path of hopefully getting off of her insulin and metformin and other diabetic medications. So, real quick, want to talk about our prescription drug coverage. Of course, all of our plans, our MAPD plans, include prescription drug coverage. For those of you who are familiar with Capital Blue Cross and have contracted with us in previous years, we used to have a 6-tier formulary. We've changed that for 2023. It was creating a little too much confusion in the market, and we wanted to align with what else was available out there for folks. And so that tier 6 that we had, that was primarily a zero copayment for maintenance medications, and we've shifted those drugs into primarily a tier 1 and tier 2 category, and we're better aligned, we think, for 2023 with our 5-tier structure in our formulary. We still have the same list of preferred pharmacies, and so you can go to just about any pharmacy using our drug coverage. But if you want the best bang for your buck and the lowest copayment possible, our recommendation is that you go to one of our preferred pharmacies for the low copayment, zero copayment on tier 1, and some of our plans zero copayment for tier 2 at our preferred pharmacies, including CVS, Rite Aid, Giant, Walmart, and Sam's Club, because Sam's is owned by Walmart, Walmart and Weiss Markets, as well as our mail order pharmacy is also obviously a preferred pharmacy with us, where you're going to get the lowest copayment possible. Dental care included on all of our plans. Of course, the routine dental visits, which include the bite wing x-rays, an oral exam, fluoride, cleaning, 2 of those a year. Depending on what plan you're on, it's going to be either a low copayment or a zero copayment for the routine dental. And then the comprehensive dental is the benefit for restorative services, right? Including root canals and crowns, simple extractions, dentures, things like that. And it's a 50% benefit where we share the cost from $1 with our members. So if they have $1,000 worth of restorative care, they're going to pay $500. We'll pay the other $500. Quick tip on finding a provider for dental care. If you go to the MyCare Finder tool online or on your smartphone, and you type in or select doctors by specialty and add general dentist, you'll be able to search for local dental providers that are part of the network. Vision care included on all of our plans, of course. The Medicare covered exams to diagnose and treat diseases and conditions of the eyes is going to be covered on the medical portion, but your routine annual eye exam, including standard eyeglass lenses and allowance towards eyeglass frames or contact lenses, is built into all of our plans. The allowances for the frames or contact lenses, the eyeglass lens is going to be at no cost, and that's going to be your standard eyeglass lens, including bifocal and trifocal lenses. Now, if you get some of the fancy stuff like the no glare add-ons and progressive lenses and things like that, you're going to pay extra for that, but the benefit includes the standard lenses for bifocals, trifocals, at no cost to the member. And then again, another MyCare Finder tip is you can search for a vision provider utilizing that tool. You just simply select your plan, select the Find an Eye Doctor, enter your address and search all, and it'll pull up all the in-network places close by to you. Transportation benefit, another underutilized as far as I'm concerned, but another great resource and benefit for members. We changed this benefit a little bit for 2023. Last year and in previous years, our transportation benefit was a round trip benefit. And we found and got feedback from members that they didn't always need the round trip, right? Sometimes they had a way to the doctor's office, but just needed a ride home. And so we changed our benefit to be one-way benefit, so you weren't burning the round trip, 2 trips essentially for the round trip. You weren't burning both of them when you only needed a ride to or from. And the transportation benefit, of course, is designed to help you get to or from a medical appointment, which includes the pharmacy if you need to get to the pharmacy. I think most of the other plans out there, and you guys would know better than me, but most of the other plans out there, typically the transportation benefit, I think, just gives you perhaps transportation from the hospital after an inpatient hospital stay, or our transportation benefit will take you to the eye doctors, it'll take you to outpatient procedure to or from if you need a way to get there. The coverage includes one-way trips up to 60 miles one way. And so, based on exactly where you are in our footprint, and certainly with the cost of gas these days, some people, if they have a specialist they're meeting with and they're 30 miles away, don't want to burn their own gas, you can utilize that transportation benefit. In order to schedule the transportation, it's as simple as calling member services at least 2 days, 48 hours prior to your scheduled visit. Obviously, you need to have your appointment time and date, pickup time and destination address, physical location of where you're going, and then detailed details about your physical condition, because sometimes scheduling transportation and arranging transportation for our members um, uh, is as simple as, and can include an Uber or a Lyft schedule for that member to get to or from the doctor's office. But based on their physical condition, if it requires some sort of medical transport because they're wheelchair bound, that can all be arranged. And so you just need to call member services 2 days prior. The more lead time, the better, but we'll get that scheduled for you. The next thing I want to talk about briefly is the OTC, over-the-counter benefit with our My Benefit card. We rolled this out last year, and quite frankly, we got a lot of feedback from our broker partners, as well as our existing members that wanted, and they kept telling us, look, we want more flexibility in purchasing or accessing over-the-counter items, Medicare covered over-the-counter items. And we don't want to just be restricted to ordering out of a catalog, right? And so we listened and we rolled out the My Benefit card, which is a Capital Blue Cross branded MasterCard debit card. And now with this rollout came some challenges, still experiencing some challenges with getting the funds added properly, or in some circumstances it not working quite right at the point of purchase in a retail environment. One important point I like to point out, although the card, as you can see, there's an image of the card on your screen. It says debit card, right? And it is a debit card because the money is loaded on there, and you have access to a certain dollar amount every quarter based on the plan that you're on. It is a debit card, but at the point of sale, at the point of purchase, at the cashier, when you scan your card or put it in the machine, or the cashier swipes it, it may ask you, is this a debit or a credit transaction? And you want to confirm that it is a credit transaction, because a debit transaction requires a PIN, and we don't give you a PIN number. There's no PIN number associated with our MasterCard debit card for OTC, our My Benefit card. And so, that's created a little bit of confusion, but you wouldn't treat it as a credit transaction. That'll help things go a little smoother for your members. Just a little tip there for you. Obviously, the card needs to be activated when it arrives with the member. There's a little sticker on the card, just like receiving your credit card in the mail. You call the number. There's also a QR code that can be scanned if you have a tech-savvy senior that can scan that QR code and activate the card that way. I encourage folks also to download the Nation's Benefits or My Benefits portal app from the App Store or Google Play. That way they can check and see in real time what their balance is. The allowance is a quarterly allowance. It's use it or lose it. We don't penalize you if you are going to utilize the mail order catalog to order your benefits. You can order a mail order shipment every week during the quarter if you wanted to, and we're not going to charge you shipping ever for it. There's some carriers out there that starting on the second shipment in a quarter, they start to hit you with shipping charges. But never with us. And if you had download that the My Benefits app for your smartphone, again, you can see in real time what your balance is, and so that's helpful if you do go to Walmart and pick some things out and pay for them and come home and realize, oh, I forgot to get Band-Aids. You can go online or call Nations directly and mail order whatever you forgot at the retail store, and we're not going to ship you. We're not going to hit you with shipping charges. Shipping is free, and you'll be able to see on that app exactly how much balance you have left. Shopping in a retail environment, this is not an all-inclusive list. More retailers are being added, but currently we're telling folks local retailers, CVS, Rite Aid, Walmart, and Walgreens. You shouldn't have any trouble purchasing your OTC items at those retailers. Now, some retailers are a little bit better than others in terms of identifying what OTC items are available and eligible under Medicare from their store. Some retailers will actually brand the packaging with the OTC symbol on the side of the box, which will be helpful. But those are the retailers: CVS, Rite Aid, Walmart, and Walgreens. We recommend you shouldn't have any issue. I was doing some testing the other week and didn't have any trouble at all making purchases at any of those 4 retailers. So the other benefit that's sort of tied to this debit card that we issue to all of our members is the healthy food allowance. And this is a popular benefit for folks because it if you qualify for it as a member, you have to have one of the 4 qualifying conditions: diabetes, chronic lung disease, cardiovascular disease, or congestive heart failure. But if you qualify, you'll get an extra $60 loaded onto that debit card that you can go to a local grocer and retailer. I'll show you that list here on the next slide. And purchase up to $60 per quarter of healthy foods, right? Now it's a claims-based qualification in order to be eligible for this healthy food allowance, this additional $60 added to your card. Typically, what happens when you go to the doctors and then they send us a claim. All the claims should be including from the providers the diagnosis codes. And if the diagnosis code for one of those 4 conditions is on those claims, what's going to happen is it's going to trigger a letter from us to the member prompting them to call the telephone number on the letter to opt into the healthy food benefit program. Medicare requires this be an opt-in program. So they got to call and opt in once that claim triggers the letter sent to them. So things like dairy, fruit, vegetables, meats, and whole grains are eligible to be purchased utilizing that $60 benefit. It's just like the OTC allowance. It's a use it or lose it benefit. And again, I talked about it being an opt-in benefit. It's loaded into a separate wallet on that same OTC card. Giant, Weiss, and Walmart are the 3 retailers we're currently listing. It has been this benefit has been utilized at other locations besides those 3, but those are the 3 that we're confident Nations Benefits has an agreement and a contract with: Giant, Weiss, and Walmart. And the last thing I want to leave you with before we open it up to a little Q&A is the Capital Blue Cross Connect stores. And this sort of ties back to the benefits of being a small regional Medicare carrier. Is we're committed to the communities in which we serve in central Pennsylvania, Lehigh Valley, including opening and having 5 different Capital Blue Cross Connect retail locations accessible to all of our members to utilize the benefits. A point I want to make, especially when I'm talking to our broker partners like I am this morning, our Capital Blue Cross Connect stores are not competition for you, right? So I wouldn't feel that way. You're welcome to go in and walk in and say hello and introduce yourself. The Enola store is our flagship store. It's got the Healthy Foods Cafe in there. You can go to yoga classes. But more importantly, I think for you and for your clients, it's another resource, another layer of service that's available to them. If they have an issue or a problem and they can't or don't want to call member services, they'd rather talk to somebody live and in person directly with Capital Blue Cross, they can walk into one of our retail stores and request some assistance with a question they might have specifically about their benefits. And so I just wanted to, on the screen there, the locations of the 5 different Capital Blue Cross Connect stores. And on the left-hand side, of course, some services that are available. including the member services, health coaches and screenings, exercise classes, different community events, and at some of the locations, healthy food and drinks available at the Capital Blue Cross Connect stores. Karen, that is all I had that I wanted to go over. Obviously, if you have any more specific details about the different PPO and HMO plans that we offer, we have a whole portfolio of zero premium and buyback plans, PPO and HMO plans. If you want more information, certainly through URL or reach out to me directly. I'd be happy to get whatever information to you, at least initially in digital format, including brochures that show benefits and summary benefits and details about the plans. But I wanted to spend a little bit of time this morning talking about some of the additional benefits that are offered and available through most of our plans. And so hopefully you got something out of it, you learned a little something. And, at this point, Karen, I guess, I'm here for as long as you need. If anybody has any questions, I haven't been paying attention to the Q&A much. Hopefully you have been.
So no Q&A. There was one question, but it went away. So I don't know if the person who wrote it deleted it, but maybe you answered the question and didn't need to answer it anymore. So nothing right now, nothing in the chat box, nothing in the Q&A. So like Tom said, if you have any other questions, please, feel free to reach out to any one of our, agent support staff members here at the office, or, to Tom directly or your broker manager at Capital. That's it. I mean, thank you so much, Tom, for joining us. We really appreciate it. It was a lot of great information. I've been to the Capital store over in Enola. My grocery store is right next door to it. So I've actually gone in and went to the cafe and had something to eat there. It's delicious. So if you're ever in the area, I highly suggest going over there. It's
thank
really,
God
really
it's
nice
relatively
facility.
healthy, because it can be dangerous. It's pretty delicious.
Yeah, it is. It is. Yeah. Yeah. So thanks again. We really appreciate it. This is recorded and it will be sent out to everybody who has attended. So you'll be able to listen to the presentation again if you missed anything, and maybe gain some additional insight if you did miss something. So again, thanks again for joining us. Thanks to Tom and Capital for presenting this morning.
Thanks for the opportunity, Karen. I really appreciate it, and thanks to everybody on the call listening in.
Have a great day.